papers, manuscripts.
Sorry, you're just gone on mute again.
مشكلة درسي. إزاي
There we go.
Let's see. Okay, is it okay right now?
Yes, I can hear you. The screen is just a bit delayed, but yes, we can hear you.
Okay. So I saw that I found this paper very interesting, and suddenly I saw Dr. Rudman as one of the authors. So I contacted him and asked him to arrange this meeting for us. Now we are in our journal club that we held routinely, and would like to start this journal club for today. My let's see. Dr. Heidari is helping me for today presentation. Would like you to start your presentation now.
Good morning, everyone, and welcome to today's Journal Club. My name is Monire, a PhD candidate in Community Oral Health at Tehran University of Medical Sciences, and I have the pleasure of moderating this session. First, I would like to extend a very warm welcome and thanks to Dr. Marcus for being here today with us. It's a real privilege for us to have the author of the paper here. And Dr. Marcus, we deeply appreciate your time and willingness to share more about your important work. The article we are discussing today is titled Stakeholder Attitude, Experiences and Perceptions of the New South Wales Primary School Mobile Dental Program, recently published in Community Dentistry and Oral Epidemiology. Following Dr. Marcus' presentation, we will move into a discussion session, and we will then share some questions and reflections. And once again, thank you very much, Dr. Marcus. We are excited to hear from you. Thank you.
Thank you. Thank you so much. Happy to share.
All right.
Can you see this at the moment, my screen, or?
Just a minute.
Recording in progress.
I just want to reassure you that we all have this technical issue with the screen sharing and then on the different screens and.
Yeah, but we can see your slide in good, full mode.
Can everyone else see it in the room? Are we ready to start? It just looks like.
Sorry.
Okay. Yeah, I think it's the.
نه اینو می‌دونیم که شو بس کنید وای فای شو.
Okay, ready to go?
Yeah, please go ahead.
Okay, sure. Thank you so much for the warm welcome and introduction. As discussed, I'll be talking about our study, the stakeholder attitudes, experiences and perceptions towards the New South Wales Primary School Mobile Dental Program. I'm here based at the University of Sydney as well. I just wanted to acknowledge the traditional custodians of this country, Australia, and pay respect to elders past, present and emerging on the lands that the University of Sydney's campuses stand on. For thousands of years, they have shared and exchanged knowledges for the benefit of all. To begin this project, we had a large team working together. We at the Leader Centre for Health Policy, Economics and Data, we had oral health professionals, we had health policy economists, we had also health economists part of the project, and we were partnered with the New South Wales Ministry of Health, specifically the Centre for Oral Health and Strategy and the Centre for Epidemiology and Evidence. It's also important to note that this evaluation was actually funded by the New South Wales Ministry of Health as well. Our paper was also recently published, as discussed earlier in this meeting. So the Primary School Mobile Dental Program, its aim is to provide preventive oral healthcare services for children in primary school, so the ages between sort of 5 to up to 13 years of age. We're also looking at sort of public primary schools in New South Wales. This program also initially targeted socioeconomically disadvantaged regions and populations. We conducted this evaluation of the program between 2019 and 2023, and during that time, the COVID-19 pandemic impacted program implementation because schools shut down in New South Wales. And of course, the pandemic influenced and impacted everybody globally. In terms of our study, we had 5 different components that were evaluated, but this is part of a mixed methods analysis.
Sorry, Dr. Marcos.
That's okay.
We have a problem with the voice. Let me fix it and then continue, please.
Sure. Let me know when.
صداش باید بیاد به تلویزیون ولی نمیاد. نه درست بود آخه. صداش درسته. الان صدا میاد.
Testing? Can you hear me?
Yes, we can hear you.
Okay. Is that okay to continue?
Okay. Please continue.
Sure. So this qualitative component was part of a mixed methods concurrent design in which we conducted a quantitative analysis at the same time. But for the purposes of this study, we are looking at the qualitative component of this analysis. So for the qualitative component, we were looking to interview oral health teams that were delivering the program on the ground. We interviewed parents and caregivers of children that participated in the program. We applied for appropriate ethics approvals and oral consent from each participant. Interviews were conducted between 22 and 23, and open-ended questions were utilised for the format of our interviews. Thematic analysis was also conducted using grounded methods. In terms of our participant sampling, just to give an idea of where we are, in New South Wales, the local health districts are divided up in New South Wales to provide healthcare services on the ground. We interviewed specifically in 2 local health districts. So one was the Central Coast Local Health District and the other was the Southwestern Sydney Local Health District. These 2 areas are different in demographics. So in Southwestern Sydney, it comprises about 65% of culturally and linguistically diverse communities, and Central Coast comprises a large proportion of Indigenous Australian populations and is more of a regional and coastal town as opposed to Southwestern Sydney. In terms of our sampling, we interviewed oral health dentists and oral health therapists in the workforce stakeholder group. We conducted one-to-one interviews over the phone and transcribed these word for word. In terms of the parents and caregivers, we interviewed them by sending flyers to over 80 schools. We also had oral health teams distribute flyers to children that participated in the program. We also tried to encourage participation with a $25 grocery voucher for their time because it was actually quite difficult getting parents to participate. These were also conducted one-to-one and transcribed word for word. In terms of our findings, so overall, the primary school mobile dental program visited 93 schools in Central Coast region and 133 schools in southwestern Sydney. The consent percentage of children participating in the program varied between 26 to 40% across the both districts in the 4 years. The total number of children examined over this time period was over 18,000 in southwestern Sydney and 10,225 in Central Coast over the 4 years. In terms of the oral health workforce, that varied between 9 to 13 workers in each of the two districts.
Please wait a minute.
Oh, sure.
I don't know. You ever think so? Like,
Can you speak a bit?
Testing. 1, 2, testing.
Wait. نه این بودش. صدایی داری. نمیشه
من صبر کنم بگردم پیش پیداش کنم ببینم کجا.
درست بود.
ممکنه یه چیزی ممکنه اصلا لپتاپتون باشه.
با همین تست کردن.
Testing. Can you hear me?
همون میگم ممکنه خودشون میشه. اینجوری گزینه‌ای داره. بعد
اسپیکر داری شما اسپیکر بلوتوث
اسپیکر دوست داریم.
Okay, please continue.
Okay, sure. And so the oral health workforce varied between 9 to 13 workers across the two districts that were delivering the oral health care to children over the 4-year period. And that also was impacted by the COVID pandemic during a period of time in this study as well. Overall, we had 79 participants. So there were 58 parents and caregivers and 21 oral health providers. And one of the foremost key themes was that the PSNDP promoted oral health care access. It was repeated that it was a good program, convenient, free and rewarding. A workforce participant stated that it's a good program wherein children are being assessed, and especially for working mothers, working parents, it's in a safe environment within school hours. I think it's most rewarding for me that personally children that have been neglected are being seen. This was also echoed by parents and caregivers. So they were quite grateful for the national services being provided to children. So a foster caregiver in a school from an area with high disadvantage had said that this is a brilliant idea and they need to continue it. There's a lot of kids out there that parents don't even take them to the dentist. And I know that because I have been there with these children that have never seen a dentist. One of the other aspects that came through was that the process of fully informed consent was unclear for some. So this is an example of the consent form pack. Now, this is just a little bit of it. It was considered bulky and confusing for some, and that also takes into note that there are varied literacy levels across population groups. And one of the key aspects from this study is that this consent form has been modified to highlight the free nature of care being provided, because that was one of our findings from this study. Another suggestion was that parents wanted a family pack because some parents had 3 children and had to complete 3 of these big packs for each child. So that was another consideration. We also found that stakeholders disagreed on the parental attendance. So you had oral health teams that preferred that parents didn't attend the dental visit because it was a preventive natured oriented care that parents didn't really need to be involved in, whereas some parents desired to be present during the mobile dental visit just to support an anxious child. We also found differences between the LHDs. So Southwestern Sydney oral health teams, some of them provide time barriers. So some of them felt pressured in terms of seeing the number of kids in a short amount of time, but this was not echoed in Central Coast oral health teams. The final aspect of our finding was that parents and caregivers wanted clear communication about their follow-up care processes. So this is an example of a mobile dental van that goes to a particular school that's participating in the program and stays there for a week or 2 weeks, and then children that have consented to participate, but parents that have consented their children to participate will then come and see the oral health team in the mobile clinic. They'll provide preventive oral health care education, and then scaling, cleaning, and checkup, and then anything that requires further treatment will be sent or referred in a letter for their parents to see the public dental clinic for further treatment. So overall, our findings found that participants had positive attitudes and experiences with this PSMDP. There is a need to consider the time allotted per child and parental attendance considerations for this program, and there was a need to improve follow-up communication and care coordination after the mobile dental visit. Some of the implications from this study is that these findings, some of them have actually been incorporated because the program has expanded in New South Wales. So the consent form has been modified to highlight the free nature of care being provided, and the follow-up care letter has become a lot more detailed to specify exactly what type of care coordination is required. The PSMDP also supports access to socioeconomically disadvantaged areas, remote and rural regions, as well as culturally diverse populations. It also aligns with the Sustainable Development Goals and the WHO Strategy and Action Plan on Oral Health. There are, however, study limitations. So we can only interview those that participated in the program. We couldn't get ethics approvals to interview teachers because of the COVID pandemic that happened and the compounding effects on school teachers. So we didn't get ethics for that. So we were unable to interview them. We also didn't interview children themselves, and also noting that this is not representative of all entire contexts around the country and around the world. So that brings me to the end of this overview. It's a very complex program and study, and this is just one part of it. So I'm happy to take questions. Sorry, you're just on mute.
Yes.
Thank you, Dr. Marcus, once again. With your permission, we will go to the next part, the discussion part, and I will ask some questions and reflections. And after that, I ask my colleagues to say their questions. First of all, in the article, there were the term of oral health staff. And you mentioned that it means oral therapists and dentists, yes. So my question is, was the presence of a dentist necessary, and how was the divide
Tasks.
the task division? How was the task division there?
Yes. Okay.
What
so
did the
that's
therapist do, and what did the dentist?
okay. So that's it was mostly oral health therapists, and so there was a shortage in particular regions, both of the regions during particularly COVID. So they had reduced numbers of staff. So sometimes there was a dentist, but mostly it was actually oral health therapists. And they were providing oral health education to children in the mobile dental van, scaling, clean, and then if an x-ray was required, maybe an x-ray. And then if they were required to have further treatment, they would be referred on to the public fixed clinic, which is where the dentists are to provide extractions or more treatment oriented services.
Thank you. And you selected only 2 of the 5 health districts, yes, for this study, just 2. Do you think this might affect the generalizability of the findings or not?
Yes. So this study, because it was conducted in conjunction with 5 other sort of components, including a survey analysis. So this survey analysis we conducted in 5 local health districts with the parents and caregivers. And although those findings can't be discussed in this paper, they actually aligned with all the findings in this study with the qualitative findings that we have. But no, I mean, we can't generalize findings to all populations. But when we looked at the findings from the survey analysis, which was over 2,500 parents and caregivers across 5 districts, those findings echoed the same findings from this qualitative interview.
Thank you. And my next question is, did you pilot the interview guides before you use it or not? And how did you assess whether the questions are enough or clear or effective?
Yeah, that's good. So we did pilot it. So initially the program was being conducted and this was the ethics, the semi-structured guide was submitted to ethics. And before that was submitted to ethics, that was piloted with not only the team and the New South Wales Ministry of Health, but also some public members as well. So they piloted that before we submitted that to ethics. And then this was a semi-structured guide. So it was sort of open-ended questions to allow for flexibility in findings.
Thank you. I have some more questions, but before I ask my questions, I want to ask my colleagues and faculty members to ask any question if they have, and after that, if there were nothing, I will ask my other questions. Is there any question? Yes, Dr.
Dr. Shamshi.
Yeah.
Okay.
Hello, Dr. Marcus. My name is Dr. Park Saman. Actually, I'm PhD graduated from Sydney University, and I'm working at Tehran University now. So nice to meet you and also the colleagues from Sydney. I have a question. Can you just explain briefly about the preventive care package that you delivered to children? Because it is also here in Tehran University, we have also some activities regarding oral health promotion of school children as well. Thank you.
Oh, nice. Yeah. So it's basically the child is collected from the class. They're taken to the mobile dental clinic, and then the oral health therapist will begin by first checking their details and then discussing their diet, maybe sugar intake, things like that with the child, encouraging healthy eating, find out about their brushing habits and whether, trying to encourage the twice brushing a day. And then they will conduct a check in their mouth. And if there's time, they will do a clean and if required, an x-ray. But otherwise, that's most of the preventive work that they will do with the mobile dental clinic. They will then provide the letter to their parents to say, this child needs to see the public dental clinic for further treatment.
Okay, thank you very much. Thanks.
Okay.
Dr. Shamshi. Okay. Yeah.
Hello, Dr. Marcus. My name is Sogoli, and I am a PhD candidate in Tehran University of Medical Sciences. According your, I think, first or second slide, you mentioned that there was an economic evaluation of this program. My question is, what kind of analysis did you conduct on this program? Was it cost effectiveness or any other type of analysis?
Yes, thank you. So there were quite a lot of extensive evaluation conducted. So we conducted an implementation model mapping across the 5 districts. There was the economic evaluation, which conducted a cost benefit analysis as well as predictive modeling as well. And then there was a risk benefit questionnaire analysis that was also conducted, as well as DMFT and outcomes. So there were quite a lot of components. It was a comprehensive analysis, and the findings are with the government. So whether they want to make that information public or not is up to them, because they are the data custodians. Yes.
Thank you.
That's okay.
Peki, لطفاً میکروفون دکتر شمشیری رو باز کنید.
Thank you. I want to ask Dr. Shamshi to ask his questions.
میکروفونشون میکروفونشون رو باز کنید. خانم صادقه، لطفاً میکروفون شمشیری رو.
Can I ask another question to?
Yes.
Okay, I want to ask another question till Dr. Shamshi join us. All interviews were conducted in English. So do you think this may have excluded some perspectives, especially for those from linguistically from diverse families?
Yes, so that's a great question. Yes, it would have excluded those only because we didn't have the resource available to pay for a translator. So yes, we were limited in terms of resourcing ability to pay for translators into the study. The consent packages for this program is translated in multiple language, and then the survey analysis, which is not part of this interview, but the survey questionnaire was also translated in about 10 languages as well. So that also provided feedback from parents and caregivers in Arabic, in Mandarin, Cantonese. We got quite a lot of responses from non-English speaking backgrounds to the survey. But yes, in terms of the interviews itself, we did have a participant who had their parent wanted to participate but could not speak English well, and they had a teenage daughter who did translate, and then I sort of spoke in a 3-way conversation that way. So we did have one person that didn't speak English participate, but otherwise, yes, it was unfortunately something that needs further research with non-English speaking backgrounds.
Thank you. Dr. Shamshi, can you say something?
Is unmuted.
Yeah, hello. Thank you. Thank you, Dr. Marcus, and thank you for, yeah, can you hear me?
Yes.
Okay. And thanks, Dr. Hessari and other colleagues that make this opportunity. I'm Ahmad. I'm epidemiologist. Dr. Marcus, I have a question. This program supported by the government completely, as I read the article, and I want some documents and your explanation about the cost effectiveness of the program there.
Yes, so we found a moderate to sort of just slightly over median moderate benefit analysis according to the modeling. The program was largely impacted because of COVID-19, and what that meant was schools shut down. So the program actually couldn't be delivered across schools, because in New South Wales, we shut down everything. We shut down the schools. So the program couldn't actually go out and help schools. But we found the most strength in the year 4 of the program. So year 4 was basically a sign of resilience of the program, and there was quite a lot of strength in the numbers of children seen, the number of people participating, and as well as sort of overcoming some of this initial cost, because I mean the cost purchase of mobile dental vans would have been initially high. So that was shown under modelling. Again, all of this information is with the government in a comprehensive 300-page report. Whether they want to make that available is now under their unfortunately, it's up to them.
The program launched on 2019. Am I right?
Yeah.
So
yeah.
what the primary studies? Yeah, the primary study should be started. I don't know. For example, 4 or 5 years before that. Yeah. And do you have any publication about this program?
No. So we started the evaluation mid-2019. Prior to that, there's no sort of publications on this specific program, but we have a Smile Squad program in Victoria, and that it's a Victorian government. Yep. So there's some publications about that, but at the moment this is the first publication from this program to be out.
Thank you very much. I have a suggestion for Dr. Hessari to review the process of development of this program from 2009 till now. Thank you very much.
Okay.
Thank you.
Thank you very much. Any other questions, friends?
Hello, Dr. Marcus. I'm Nusha, PhD candidate. I appreciate you for useful study. I have a question. Considering about 4 years have passed from your study, do you have any evaluation to assess the impact of your study on objective impact like DMFT index or oral health index?
So that's right. So that was DMFT index. That was something that was conducted during the evaluation as part of a different component of this evaluation. That, again, the figures were difficult to assess for the period of 22-23 because there were a whole heap of shutdowns. Hospitals weren't taking children in at the time because of COVID, and there were quite a lot of changes around the world in healthcare itself. But it's been published with the government again, and it's up to them whether they're going to allow us to release any further studies with this. The DMFT showed an improvement, particularly in the highly vulnerable Indigenous communities, as well as some remote communities and some culturally diverse populations. So the program was definitely meeting the needs of very vulnerable groups. And so there was a slight improvement in that as well. But I don't know if or when that will come out.
Thank you for your answer.
Okay, that's okay.
Hi, Dr. Marcus. Thank you for joining us today. My name is Tina, and I'm one of the PhD candidates. So my question is about the packaging and the consent forms that you distributed to the participants. As it was mentioned by the participants, the forms and also the packages were a little confusing and bulky to some of them. Were there any efforts or, I don't know, future plans to eliminate these issues, like offering multilingual options, or let's say an in-person session with the parents and the dentist or dental professionals to tell them about the terminology related to the dental procedures that are being offered to them? Thank you.
Thank you for the question. Yes, so the consent packs, they are translated into, I think it's about 10 languages. So they do that. As a result of this study, they did try to clarify some of the confusing aspects, which is around the money aspect, but it was about the fact that this program is free. And so that was highlighted again. In terms of asking, they don't have the capacity to, I guess, provide more resources to help parents, but there were parents that did reach out to the teachers, who then reached out to the oral health teams, who were happy to get in touch with the parents and clarify things. So there were some instances of that happening. It's a good suggestion that maybe there could be information sessions as well. It would have been good if we could interview teachers as well, just to understand their perception as well. But the consent packs, they've tried to simplify it. And I mean, they've tried to simplify it. Let's see how that goes. Thank you. Sorry, I think you're on mute.
Can you hear us? Yes.
Thank you. Yes, perfect.
Hello, Dr. Marcus. I'm Satare. I'm PhD student in Tehran University. Did you gather any follow-up data on whether families access further dental care after receiving referral letter? My
Yes,
question.
thank you. So yes, we had something like 1,000 kids received follow-up care at the public dental clinic in one district, and something like nearly 1,000 in another district. So that's for further treatment. Those numbers don't take into account private dental providers. So if a parent saw the letter and decided to go to their private dentist down the road, we can't capture that data. It only captured those that visited a public dental clinic. But yes, the numbers, because the program sort of really took full effect in year 4, the numbers weren't as large, but still 1,000 kids receiving treatment in a dental clinic was quite positive in one district. Thank you.
Thank you very much. From online friends, if there is any question, we can hear you. Okay, so I want to ask, and here, if anyone wants to ask a question. I want to ask my last question. You mentioned that purposive and snowball sampling methods were used, but the paper doesn't clearly state the criteria for selecting participants. Could you please explain more about the criteria?
Sure. The criteria wasn't too extensive. It was just children that participated in the program. So parents and caregivers of children that participate in the program, we wanted to gauge their feedback about their experience, sort of what happened, and any sort of concerns they had. These were parents and caregivers that were in schools that were participating. So that's another note, is not all public schools wanted to participate in the program. So these are just participating schools as well. The purposive sampling was basically asking a parent at the end of an interview, do you have any other parents that you know? Often there were parents that would say, I was referred, my friend used the mobile dental clinic, and they told me about it. And then I said, oh, I'd be happy if you shared our study flyer with your friends who participated in the program. And then they would send it to their parents' network that participated in the program. And that's sort of the purposive sampling, snowball sampling that we used for that.
Thank you very much. Any other questions? Dr. Marcus, we are here, as you see, alongside several professors and PhD students. And on behalf of everyone, I would like to sincerely thank you. We wish continued success for you and your colleagues in the research and your program. I would like to invite Dr. Khami, the head of the Department of Social Dentistry, to address you.
Okay, can you hear me? Okay. Thank you, Dr. Marcus. I just want to cordially thank you for being with us in this session. I know that it was the end of your working day, but here we are at the beginning hours and also at the beginning of the week, but you are in the weekend. So I thank you. I want to thank you for this, I think, fruitful sessions. Several topics were discussed, important topics in the field of dental public health. The core concept is to provide vulnerable population with essential dental care package, and the concept of integration, the concept of the package for people underserved population, and finally the UHC, universal health coverage. And we all know that the concept of no UHC without oral health. And I think your work is a very good step towards UHC. I hope that we can continue, you can continue, and we can continue with you and your colleagues in the University of Sydney. We know some of them, Dr. Rudman, Dr. Christian Bradley, and also Dr. Rajesh. And I hope we can have some other sessions with your colleagues and you again in the future. Okay, thank you very much. Thank you.
Yes, thank you. Thank you so much. It's been a pleasure to share our study, and thank you for all these very interesting questions. It's been a great experience.
Do you have any question from us?
No, thank you. It's really positive to see a lot of young students, PhD students as well. That was quite nice to get a lot of questions from PhD students. Is encouraging as well. So, thank you.
Okay, I also thank you, and that there were a number of colleagues and co-authors with you, and that was certainly a huge work behind of that paper. And I would like to congratulate all of you and hope you to enjoy the benefits of that program for all the people. Thank you, and I would like to close the session right now.
Dr. Shamshi suggested to take final photo.
Okay. Final. If all of
Open your
us
cameras.
open your cameras, please. Into screen again. So any other cameras? چیز کنم من فول اسکرین کنید. ببینید فول اسکرینش کنید. How can no. Okay. یه پرینت اسکرین یه نفر بگیرید که هر کدومتون بگیره. Thank you. گرفتی پرینت اسکرین؟ پرینت اسکرین. شما با موبایلتون هم بگیرید. نه با موبایل خودتون پرینت اسکرین صفحتون رو بگیرید. Thank you.
Thank you, everyone. We will officially close today's journal club. Thank you all again, and have a good day. Thank you, Dr. Marcus.
Bye.